Coming to the blood vessels of the body, uh, you have the arteries and the veins. So in this session, I'm going to show you the major arteries and its branches, and also the major veins and its branches, and finally we will close with the superficial veins. Okay, so for this I have to remove this artery, pericardium. I remove this pericardium. Okay, now what you see here is this uh, heart, and the first branch of the heart. Okay, so what you see here is the heart. Okay, the heart starts with the blood vessels start. The first branch of the heart is the aorta. The first branch of the heart is aorta, and this aorta is the largest blood vessel, and it starts in the left ventricle. The aorta starts in the left ventricle, and this is the origin point of aorta. Okay, so for this I will remove the ventricular wall and the septum. Yes, this is the aorta. Okay, this is the largest blood vessel in the body, which is having around 2.5 centimeter diameter, and this is the aortic valve. Okay, so in the aortic valve, the first branch is the coronary artery, the right coronary artery, and the left coronary artery. This is the left coronary artery, this is the left coronary artery. Okay, this is the left coronary artery, and this is the right coronary artery. So if you look at this left coronary artery and right coronary artery, they are supplying the myocardium. So in fact I have discussed about the branches of the coronary artery in the previous lecture, so I hope you will understand, you will know. And for your information, this coronary artery is the first branch. The coronary artery is the first branch of the aorta. So this part is called as ascending aorta, and this part is called as the arch of aorta. This part is called as the arch of aorta, and this part is called as the descending thoracic aorta. This part is called as descending thoracic aorta. So if you see the ascending aorta, it doesn't give any branch, whereas the arch of aorta, there is a small connection. This is a pulmonary trunk. Okay, and there is a small connection. This is called as ductus arteriosus or ligamentum arteriosum. So what happens in the fetal circulation? The blood will exchange between this aorta and the pulmonary trunk. Okay, so if this is not fused after birth, then the oxygenated blood will mix with the deoxygenated blood. That condition is called as patent ductus arteriosus. Okay, so in the arch of aorta, you see the first branch is the left brachiocephalic trunk. Okay, sorry, the right brachiocephalic trunk. So brachio means hand, cephalic means head. So this is going to the head, and this is going to the trunk. Okay, then in the left side there is no brachiocephalic trunk. Instead, this end is directly originating in the aorta. Okay, so see, this is the right common carotid artery, this is the left common carotid artery. Okay, this is the right subclavian artery, and this is the left subclavian artery. So this is missing in the left, the brachiocephalic trunk is missing. Okay, so coming to the descending thoracic aorta, it gives around 12 branches. Okay, it gives around 12 branches. That's intercostal branch. We call it as intercostal branch. So if you see in the skeleton, you have you see, these are all the intercostal branches. I will remove couple of bones, ribs, and show you. Okay, this is the intercostal branch. Okay, this is intercostal branch. And also there are branches that is supplying the mediastinal organs. There are branches that is supplying the mediastinal organs. Okay, so this is the esophageal artery, then pharyngeal artery is present here. This is a pharyngeal artery, pericardial artery, and all this stuff. Okay, now what happens once this aorta pierces the diaphragm? Once the aorta pierces the diaphragm here, it takes the name as abdominal aorta. It takes the name as abdominal aorta. So this abdominal aorta, it has three paired branches and three unpaired branches. Paired branches are this right and the left inferior phrenic artery. Okay, this right and the left inferior phrenic artery. Okay, this is the inferior phrenic artery, one pair. Then you have the renal artery. Okay, that's going to the kidneys. Okay, that is going to the kidney, the right renal artery and the left renal artery. This is the left renal artery. Okay, this is the right renal artery and the left renal artery. Okay, this is the right and left renal artery. Okay, that's going to the kidney. Then testicular artery in case of male, that is in pairs. Okay, the testicular artery that is in male, this is the testicular artery. This is the right testicular artery. You can see the branch is originating in the aorta directly. This is the right testicular artery and this is the left testicular artery. This is the left testicular artery. Okay, you can see this is a pair. So these are the paired branches, whereas in female it is ovarian artery. Okay, it is a ovarian artery. Then unpaired branches are number one, that is the celiac artery. We call it the celiac trunk. Okay, that is going to the liver. That is a hepatic artery. Okay, now what I will do, I will select the celiac trunk, and these are the branches. These are the branches of the celiac trunk. Okay, so you can see here, this is the hepatic artery, and this is the gastric artery, and this is the splenic artery. Okay, these are the branches of the celiac trunk that is going to the liver, then stomach, and also the spleen. Okay, and it is also giving other branches like dorsal pancreatic artery, and this is the branches of the splenic artery. Okay, then the next unpaired branch is this superior mesenteric artery. This is the superior mesenteric artery, and it is supplying the midgut of the intestine. Okay, from second part of the duodenum to the medial 2/3 of the transverse colon. Okay, and this is the superior mesenteric and branches, and this is the inferior mesenteric artery. Okay, the inferior mesenteric is supplying the descending colon, rectum, and the anus. Okay, so these are all the unpaired branches of the abdominal aorta. Okay, now this aorta, it bifurcates, the abdominal aorta, it bifurcates. Okay, the abdominal aorta is bifurcating. Okay, the abdominal aorta is bifurcating at the L4 L5 level. Okay, this is the bifurcation point, and it is bifurcating at the L4 L5 level, and here it is dividing into right common iliac artery and left common iliac artery. Okay, this right common iliac artery divides into internal iliac artery and external iliac artery. This external iliac artery continuing as a femoral artery, and this femoral artery at the level of the knee, it divides into, it changed the name as a popliteal artery, and thereby it divides into anterior tibial and the posterior tibial. This posterior tibial gives another branch called as the fibular artery, also called as a common peroneal artery. Finally, this common perennial anterior tibial artery, it forms a dorsalis pedis. This artery is called as a dorsalis pedis. Okay, then the posterior tibial artery, this is the continuation of the posterior tibial artery, and you can feel the pulse of the posterior tibial artery in this area. Okay, likewise, coming to the arteries in the upper limb, okay, so what you see here is, this is the subclavian artery, then it continues as an axillary artery, then this axillary artery continues as a brachial artery. Okay, then brachial artery divides into radial artery and the ulnar artery. Okay, they go and form a arch. This is the anastomosis. This is a superficial palmar arch. This is a superficial palmar arch. Okay, so this is the anastomosis. Okay, likewise, in the neck, you have the common carotid at the level of this C3 vertebra. It divides into external carotid and the internal carotid artery. Okay, so this is called as carotid bulb, and this is internal carotid artery. It divides into external carotid and the internal carotid. So this external carotid artery, it gives various branches like this one. This is the superior thyroid artery, and this is the facial artery, and posteriorly it is giving the occipital artery, then the auricular artery and superficial temporal artery. Okay, and also middle meningeal artery, that is going inside the meninges. Okay, this is the middle, it gives a middle meningeal artery, maxillary artery, and then inferior artery. Okay, so what I have to do is, I should hide this to show you the middle meningeal artery. Okay, yeah, this is the middle meningeal artery. Okay, it is originating in the external carotid artery. Then the internal carotid artery, it is going inside the cranium to form the circle of Willis. Circle of Willis is formed by this internal carotid artery and the vertebral artery. Okay, it is formed by the internal carotid artery and the vertebral artery. You can see here, the vertebral artery is going inside the cranium and forming this vertebrobacillary artery. This is the vertebrobacillary artery. Okay, this is a vertebrobacillary artery, and here you can see this is the common carotid artery, and it is going and joining with the circle of Willis here. It's joining with the circle of Willis. Okay, so now this circle of Willis is very what do you say, it's very critical. I don't know, it's, if you understand the concept, it is easy. So let me draw that picture and show you. Okay, you see, this is the opening of the internal carotid artery. Okay, what you see here is, this is the right internal carotid artery and left internal carotid artery joining the circle. This is the right vertebral artery, left vertebral artery joining this circle. Okay, so what happens here, the blood is passing through this and then joining the circle. Likewise, the blood is passing through this and then joining this circle. Okay, so this is where the largest collateral circulation is maintained. Okay, so now this blood goes to the anterior cerebral artery and middle cerebral artery. Okay, and this blood is also coming through the posterior cerebral artery. Okay, this is the anterior communicating artery and this is the posterior communicating artery. Okay, so this is how the collateral circulation, this circle at the center you have the optic chiasma, so this is called as the circle of Willis. Okay, so note down two internal carotid artery and two vertebral artery forming the vertebrobacillary artery. Here this supplies branches to the cerebellum, brainstem and all this place. Okay, so here this circle is formed. Okay, so from this circle the anterior cerebral artery, middle cerebral artery and the posterior cerebral artery is starting and it is distributing to the brain. Now what I will do, I will show you the anterior cerebral, middle and the posterior cerebral artery. Okay, so I will remove this picture, circle of Willis picture. Okay, now what I will do, here you can see this is the anterior cerebral artery, so this is the middle cerebral artery and this is the anterior cerebral artery. Okay, origin branches. Okay, so what you can see here is you can see the anterior cerebral artery and its branches. Okay, so this anterior cerebral artery it is supplying. Okay, I will hide this. The cerebral artery is running on the brain. Okay, the cerebral artery is running on the brain. So now what you know is this is the anterior cerebral artery and if you see the branches, see these are all the areas where the anterior cerebral artery is supplying. Okay, and this is the anterior cerebral artery and this is the middle cerebral artery. Okay, this is a middle cerebral artery and these are all the areas where the middle cerebral artery is supplying. Then this is the posterior cerebral artery. This is the posterior, no, this is the posterior cerebral artery is coming here. You have to go under the brain. Okay. Yes, this is the posterior cerebral artery branches. Okay, these are all the areas where the posterior cerebral artery, you know, this ACA, MCA, PCA is present on the right side as well as on the left side. Okay, so the just know these are all the areas where the posterior cerebral artery is. So why I am showing you this, because if because of high blood pressure, if middle cerebral artery is damaged, then these areas will not get blood supply. Okay, in case if the posterior cerebral artery is blocked by embolus, these areas will of the brain will not get blood supply and the patient will suffer from vision loss. This is what you have to understand here. Okay.